And about 160,000 asthma attacks in Singapore are expected by 2040, with more people with that condition ending up in hospital every year. It is a costly affair for the healthcare system. A study shows up to $77 million could be saved if admission rates are kept at or below 40 for every 100,000 people. For more, I'm joined by Dr. Lim Hui Fang, visiting consultant at the National University Hospital, and also joining us is Ms See Weili. Now, she's an asthma patient who is being managed by Dr. Lim. Yeah. All right, let's start with you first, Dr. Lim. Your research finds hospitalizations for asthma and death in Singapore. Now, those have been going down over the last 25 years.
Definitely.
But we just heard there, they're projected to go up again.
Yeah, okay. So the reason, it sounds a little bit paradoxical, right? Because the numbers are gradually decreasing over the year in terms of hospitalization and mortality. But what is it causing the 1% rise annually in terms of hospitalization? So it's due to a few factors. Namely, our population is increasing, and also, number two, the prevalence of asthma is also expected to rise. Right. And the reason is because of allergies, obesity, climate change, etc.
Oh, so these things are out of our control.
Yeah, exactly.
And I think this is where Ms. C comes in, the things that are within our control. Now, you're what, I suppose, textbook definition of an adult asthma patient. So you were diagnosed with this aged 23. You weren't born with childhood asthma. Your experience, what has it been like?
So I think when I was first diagnosed, I was in denial because like growing up, I was always active and participating in different sports. Yeah, so I never thought that I could have asthma. So I wasn't really compliant with the usage of the inhaler. And then last year when I was in Austria in the Alps, I actually suffered a life-threatening asthma attack. And I was sent to the local hospital there. Yeah, so
you are being managed by Dr. Lim now, and she must have related to you her lack of compliance, which led almost to loss of life last year in the Austrian Alps. In a way, I can see why. She's young and healthy.
Yes.
She's going to think, this is not going to kill me. How do you deal with, I suppose, a mental block, as she says here?
Yes. So the paradox is that many mild asthma patients, they do not have symptoms all the time. Okay. So they will only want to take their medication at the time of an exacerbation. Yeah, because I knew Weili was going to the Alps. So I did warn her that perhaps before the Alps, we should try and achieve the asthma control better first.
How do you do that? What's asthma control?
So essentially, I think the key in achieving asthma control is to make sure that patients take their controller or preventer inhalers. And these controller and preventer inhalers usually contain inhaled corticosteroids. Because asthma is a chronic inflammatory airway disease. There's inflammation inside the airway. And in order to control that, you need inhaled corticosteroids.
So what happened in the Alps last year? You had this attack, and then fortunately, you actually had your inhaler with you.
Yeah.
So you took that inhaler and felt momentarily better.
Yeah.
So how different is that from, as you say, control? She had it with her. She took it after the attack. Are you saying that she should have been doing it regularly, building up tolerance ahead of the attack?
Yeah, it would have been the ideal situation. Yeah, she might not have gotten an exacerbation. Was she in Singapore? Okay, but she was going into the Alps. She was going to be exposed to very cold temperatures, and that can cause bronchoconstriction, that airway tightening. And she was doing strenuous physical activities. Ideally, the ideal situation, it will be to take your controller medications daily, but take the standby medication. And if the patient has a severe attack, you can take it at the same time.
So, having heard from your doctor now, and I take it you're at least a little bit contrite, but you had another attack earlier this year, so it's not stopped you on your very active lifestyle. Yeah. So as someone with adult asthma, having to control it, how does that affect your life now?
I think after the life-threatening attack, it really made me realize that there was no need to go through so much and worry like my loved ones if if my asthma was under control right from the start. So right now, I do take the inhaler religiously and very compliantly. Yeah, and it doesn't really affect my life on a day-to-day basis. Yeah, so sometimes I do feel a little bit complacent. Yeah, but then I get reminded that it really only takes like 5 minutes of my time to take the inhaler each day. Yeah, and then that helps to bring it under control, and I actually get to take part in whatever activities I want to do.
It actually doesn't limit your life then?
I would say for the most part, no. I think the only time it really limited my life was during, even after the life-threatening asthma attack. When I was back in Singapore, I actually had some cartilage inflammation. So Dr. Lim actually advised me to stop physical activity, like all physical activity, for a few weeks. Yeah, so I think that was when I felt a little bit suffocated, not being able to...
A little bit restricted.
Yeah.
But it was temporary.
Yeah.
Yeah. All right, so these figures, which I read before I crossed you, if we can save up to $77 million if we keep admission rates to at or below 40 for every 100,000 people. These figures make no sense to someone like me. For you, is that perfectly achievable?
So I think what we need to know, why this magic figure of 40 per 100,000 total population came about, is because that is the OECD average of for asthma hospitalization. So basically in countries like Japan, Australia, Canada, their numbers for asthma hospitalization is definitely much lower than ours. Ours is about 70 to 80. So that's approximately double.
Now,
yes,
70, and we need to bring that at least
we need to half
40.
that. Yeah, but I think it's achievable. And I think if we can achieve maybe 40, 50 per 100,000 total population, we should be able to mitigate these.
So it's education.
Education, I think, yeah, if more and more patients realize that you can live life optimally by taking control of your asthma, meaning asthma is not it's a condition that can be managed with controllers. And if both doctors and GPs, doctors and patients work together to achieve asthma remission, then I think we can achieve this target.
All right. And that's despite, as you say, factors beyond our control. So climate change, obesity, these things are driving it up.
Yes.
But if we just, I don't know, be compliant, manage it better, this is definitely achievable. Okay. Well, thanks so much for joining us this evening, Dr. Lim Hui Fang. She's visiting consultant at the National University Hospital, and Ms. See Weili. She's an asthma patient who has continued a mode of living with very little restrictions. Thank you.